Good morning, my name is Chastity and I'm going to be talking about the insertion and removal of contact lenses. We're going to go ahead and wash our hands, rid our hands of any debris, and then dry our hands with a lint-free towel. Then we can go ahead and remove the contact lens from the blister pack or the contact lens case, place it in the palm of our hands, and use a multi-purpose solution to go ahead and rinse that lens. I will always recommend a multi-purpose solution unless otherwise specified by your doctor. After we've gone ahead and rinsed the lens, now we're ready to go ahead and inspect the lens. Most people will put it on their pointer finger and go ahead and inspect the lens. You want to make sure that the contact lens is shaped more like a bowl and that the edges are not sticking outwards. That could mean that the contact lenses may be inside out. Another test is by placing the contact lens on your pointer finger and taking your thumb and sandwiching that contact lens together and making sure that it still has that rounded shape and that the edges are still not pointing outwards. Now that we've inspected the contact lens for any kinds of damage, we can go ahead and insert it into our eye. You always want to start off with the same eye and same lens every time. I personally like to take my non-dominant hand, lift up my upper lid, take my dominant hand with the contact lens on my pointer finger. I'll take my middle finger and pull that lid down and look up and insert the contact lens onto the white part of my eye. I'll then remove my finger, release the lower lid, look down, and give my eyes a second to go ahead and grab the lens and remove the release of that upper lid. You can go ahead and blink and give your eyes a moment to adjust to this prescription and the insertion of the lens. You can go ahead and now do this on both sides. Again, I will always tell you to start off with that same eye every single time, just so that there's no room for error. So contact lenses do have a wearing schedule. You want to start off by wearing your lens for 4 hours the first day and then adding 2 hours, 2 hours, 2 hours, and 2 hours every single day, adding up. And you want to go ahead and have understood the do's and don'ts of contact lenses. You do want to go ahead and make sure that you appropriately clean your contact lenses. We're going to talk about removing our lenses. After you remove your lens, you're going to place it in the palm of your hand, use that multi-purpose solution, and you're going to rub your contact lens up, down, left, right, and flip the lens up, down, left, right, and that's how you clean your contact lens, by rubbing. You don't want to do circles and you don't want to press too hard on that contact lens, or you yourself can go ahead and damage your contact lens. You also do not want to sleep with your contact lenses. You do not want to swim with your contact lenses. You do not want to use tap water or saliva to rinse, disinfect, moisturize, anything of that fashion to the contact lens. When you're selecting a solution, you want to make sure you're not using a solution with a red top. That is a warning, and you do not want to put that into your eye or on your lens. Contact lenses also have a replacement schedule. You want to talk to your doctor and ask them what is the replacement schedule for you. Today we're going to be talking about the daily disposables. The daily disposables will be worn only in the day, and you will not sleep in them. You will remove them every single day by the end of the day. And contact lenses, if you're having any redness, pain, or discomfort with them, you want to remove it and contact your doctor. And always have your glasses available. Glasses always need to be with you just in case something happens to the lens. And with the removal of the lens, again, non-dominant hand, lift up, middle finger pulling down, take your pointer finger while looking up, drag the lens a little down, pinch, remove, release the lid. Do you have any questions?